for Dr. John. The first question for Dr. John is, where do we measure the aquaporin antibodies NMO spectrum disorder, blood or CSF?
Actually, you should measure it in the blood because actually it's synthesized in the peripheral lymphoid tissue and it gets transmitted to the CSF. So sometimes your CSF may be negative, but your blood will be positive. So it's important to test the blood. But if you for some reason you're taking the CSF, you can check it in. But blood is important.
Second question. Is neuropsychiatric lupus an indication for pulsing in SLE? If so, which type, central or peripheral?
Yeah, I think that neuropsychiatric lupus is a broad term actually, because headache is a neuropsychiatric lupus, or cognitive dysfunction is a neuropsychiatric lupus. So basically, at that point of clinical discussion, you think there is an autoimmune encephalitis, you think there is a mononeuritis multiplex, or you think there is an acute NMO. Anyway, an NMO you will pulse. So at that point you have to take a decision. Broadly, you can't say NPSLE you need to pulse. But if you have like evidence to say that there is active ongoing CNS inflammation or conditions which are known to cause permanent damage, because NMO, if you don't pulse, the patient will either go blind or become paraplegic according to whatever structure is involved. So that's like a tissue damaging event. So you can't take the risk of it. So broadly, you can't say, but based on what it is.
What do we give here for pulsing? We give cyclopulse or methylpred or both?
The pulsing is always methylpred because
And then you give cyclo after that, or for neuropsychiatric, you prefer rituximab?
Yeah, actually now there's a lot of shift from cyclophosphamide to rituximab to other drugs. So cyclophosphamide, as Ruchika said, for ANCA vasculitis, cyclophosphamide is becoming less and less, and rituximab is becoming more and more.
Are there any questions from the audience, sir?
So the other speakers also, if I can answer.
Yeah, any questions for Dr. Ruchika? Over there? So she's not here. Dr. John can answer. We can take one question.
Actually, I should mention Dr. Philip Halliwell is the co-founder of GRAPPA, the recommendations you read for psoriatic arthritis. And there is an ASAS which makes a recommendation for ankylosing spondylitis. He's a member of ASAS which makes the recommendations. So
that's fantastic.
There's a study called TICOPA, Tight Control of Psoriatic Arthritis, which is like one of the best article, one of the landmark articles in psoriatic arthritis. That is his article, his study.
On behalf of the Department of Medicine, we want to thank the Department of Rheumatology, headed by Dr. John, Dr. Philip, and Dr. Ruchika. Thank you to Mercy as well for the brief presentation. Thank you very much. I think we have a quiz. So if you'll all just wait for 10 seconds more, you can get a prize. So just log on.